Hello, everyone. I'm doing my presentation for our final healthcare presentation, and I'm Ashley Cross. I'm now going to cover the issue that I chose. The issue that I chose is employee retainment. And employee retainment is an organization's ability to keep and retain its quality employees. Healthcare organizations serve the community they are located in, and they need skilled employees, which are medical professionals, to treat patients and provide care so they can run. And medical professionals are skilled employees that are difficult to replace, so retaining employees is very important for a healthcare organization to be successful. Now I'm going to go over why is employee retention important to a healthcare organization. And one of the biggest factors is the cost of turnover. Most healthcare organizations offer very generous benefit packages for their employees. And when employees leave, HR has to pay the rest of their PTO and anything else they are owed. And because of the nature of healthcare organizations and the highly trained professionals they employ, it's very expensive to hire and train employees in a healthcare organization. And this is a direct quote. The average turnover cost for a bedside registered nurse in 2014 was between 44,380 and $63,400, with an annual turnover rate of 16.5% in the healthcare industry. The average hospital can expect to lose over $700,000 each year, which is money better spent on improved equipment, technologies, salaries, and other essentials. And again, this direct quote is from 2014, so the cost has increased since then. And this is going to continue on to go into a little bit more detail about why employee retention is important to a healthcare organization. There's also the public perception to consider. Healthcare organizations often have returning patients, hospitals do, and many small doctors' offices have returning patients. So patients are definitely more comfortable with the medical professional they are used to. And the public perception of a healthcare organization that constantly has new employees can be perceived as unfavorable. If you go into, say, your family practice, for example, if you go in and every single time you go in, there's a new nurse or a new medical assistant or someone that just doesn't know you as a patient, you could wonder why there's always someone new. There is also the risk of losing business if a patient decides to follow the healthcare professional to their new place of employment. It does happen sometimes in healthcare where, say, you've had a doctor for 10, 15 years and you feel comfortable with them. If they are going to leave their place of employment, say a hospital or a practice for somewhere else, many of their patients do follow them. And also, hiring outlook. Right now, there's a national shortage of healthcare professionals, and this makes the potential pool of candidates smaller. And also, this makes the recruitment for healthcare professionals right now a very competitive field. So, healthcare organizations are spending more and more on recruiting packages. So, because of all this, hiring employees can be difficult and often very expensive. Now I'm going to discuss my ideal leadership model. My ideal leadership model would really foster employee growth, employee engagement, and a positive work environment or culture that really supports its employees and acknowledges them. My ideal leadership model would recognize the importance of human capital and recognize that employees are often one of an organization's most significant and underlooked assets. Employee growth. One aspect of employee growth is setting employees up for success and ensuring employees have the tools they need to complete their jobs. And one way to achieve this is by using a strong training program that will give employees confidence in their jobs. And training is not just crucial for new employees, but it should be a continuous process that lasts throughout their employment. And there's so much training that can be provided for someone who works in a healthcare organization just due to the nature of the organization. And some of this training can be on effective communication, on how to handle complex patients. Diversity training is really one that's needed, and conflict resolution. And these are all excellent examples of how a healthcare organization can provide training to promote employee growth. I'm now going to be going over the benefits of employee growth. The benefits of employee growth are employee retainment, which is again the major goal here. Also, employees who feel engaged throughout their career with training will experience less burnout because they're still learning, they feel like the organization cares, and the organization is committed to them. And burnout is often one of the major reasons quoted by healthcare professionals why they leave their job. And it can lead to them being stressed and can affect their job performance, which again will lead to employees leaving. It also improves staff morale and it will make the staff feel engaged and committed to the healthcare organization they work for. And it can also increase patient satisfaction because the staff is knowledgeable in what they're doing, they're experience less burnout, and they will perform better than staff that is not engaged. It can also increase the staff's job competency by making them more knowledgeable and confident in their abilities. And training for medical professionals is also a bonus because most medical professionals have something called continuing education credits for their professional licenses. So, by providing regular training, it makes the staff feel engaged, valued, confident, and also takes care of their continuing education credits. I'm now going to be going into a little bit more about employee engagement. So, what is employee engagement? Employee engagement is a connection level that employees experience between themselves and their place of work. And it's important to note that there's a difference between an employee being satisfied and happy with their job and employee engagement. An employee can be happy with their job, but again, not be engaged, which will lower their commitment to their organization. And you may be wondering, why does this matter? Over the past year, the COVID-19 pandemic has taken a heavy toll on medical professionals, especially frontline workers. A 2020 survey from Mental Health America found that 93% of healthcare workers were experiencing stress, and 76% reported exhaustion and burnout. And also, only 44% of healthcare employees feel that they are currently engaged. Engaged healthcare employees lead to higher patient satisfaction rates, increased patient safety, and improved quality of care. A Gallup poll of 200 hospitals found that a higher engagement level of nurses resulted in lower patient mortality. So there is nothing but benefits for a healthcare organization when they ensure their employees are engaged. And you may be wondering, how can a healthcare organization go about making employees feel engaged? They need to foster a culture that really listens to their employees and not only responds to their feedback, but takes it into consideration. Employee engagement surveys are a great way to keep employees engaged and to gather feedback. And by gathering feedback, the healthcare organization can really use it to their advantage. They can figure out what needs improvement and what is really going to make the employees feel engaged and more committed to the healthcare organization. Another way for employees to feel engaged is to offer a recognition program. And it doesn't have to be anything of high monetary value. It can be a simple award program or just acknowledgement by their superiors or management. And on the other hand, small gifts such as gift cards can be awarded. The monetary value does not have to be high. The main aspect that we're looking at here is that something that will make the employees feel appreciated and like their hard work is recognized by the organization and their management. And I'm going to continue on a little more about employee engagement. As I mentioned previously in my presentation, providing employee education has many benefits, also as well as keeping employees engaged. offering learning and development opportunities for your healthcare staff has a measurable impact on employee retention. In fact, 70% of employees would be at least somewhat likely to leave their current organization for a job that offers better opportunities for employee development and learning. Another idea for employee engagement is an employee mentorship program. A mentorship program that involves peer support can strengthen the bond between employees and will also improve employee engagement. And incorporating employee feedback into the mentorship program will increase employee engagement and make the employees feel like they are heard. You may be wondering, does a positive work environment really matter? And what exactly is a positive work environment? And are there any benefits to a positive work environment? And does a positive work environment really help retain employees in a healthcare setting? A positive work environment is an environment where employees feel empowered and valued. And I'm going to answer the importance of a positive work environment right now. A positive work environment for healthcare professionals is important for good patient care. It reduces hospital required infection rates, hospital mortality, readmissions, and adverse events. Furthermore, a positive work environment is strongly associated with attracting and retaining healthcare professionals, which is crucial in times of healthcare staff shortages, especially with regard to the COVID-19 pandemic. So, how can we make a work environment positive? Everything previously mentioned contributes to a positive work environment, which we really focused in on the employee and growth and employee engagement aspects. And these are also some other aspects that define a positive work environment: feeling valued, job satisfaction, employees as valuable partners, open communication, and personal development. And the percentages I have by these are taken from a study that spanned over 200 healthcare organizations and interviewed all their employees. And the percentages mean that 90% of people felt employees in a healthcare organization felt that feeling valued contributed to a positive work environment, and all the other percentages mean the same thing. I'm now going to go over how can I get stakeholders to agree to adapting my model. I will present my research and findings to prove that fostering employee engagement and growth in a healthcare organization is really what's going to result in a positive work environment. A positive work environment helps retain employees, which is essential for today's healthcare organization, and I will present my findings and research to prove that. And this is because it is cheaper to retain employees than to hire new ones in today's competitive recruitment market. The hiring market for healthcare professionals is very competitive right now and expensive. And really, overall, a positive work environment only benefits a healthcare organization, so there is no reason not to focus on this. I'm now going to be going over my model's efficiency. So, what exactly is efficiency? Response efficiency refers to how quickly a system reacts to a request for service. An example of efficiency in healthcare can be patient wait times, how long a patient must wait on the phone before they talk to a medical professional or someone that's going to schedule their appointment. And there is also more than one type of efficiency in a healthcare setting. There's cost efficiency, which is how expensive it is to complete a process. An example could be how expensive are healthcare surgeries. And there's also process efficiency, which measures the amount of work it takes in order to produce healthcare products. One measure of process efficiency would be the length of time a standard process takes in healthcare, the resources used, and the number of staff it takes to complete the process. How can I determine if my model is efficient? So, the main goal of my leadership model is to promote a positive work environment that will lead to employee retention. After the model is in action, the number of employees that leave versus the number before the model can be looked into and evaluated. Also, an employee survey can be sent out. Feedback from employees is invaluable, as mentioned previously. And if my healthcare leadership model is truly efficient, all the previously mentioned benefits of promoting a positive work environment should be seen. And it's important to note that this is going to be a long and continuous process, and we're going to need to use benchmarking to truly see if the healthcare model is efficient. I'm now going to be going over my model's effectiveness. And effectiveness it can be simply stated in terms of the ability to create outcomes and actions that are perceived acceptable by stakeholders. And effectiveness can be very subjective because of this, because it is the perception of stakeholders, and it can be difficult to measure. And I would determine if it is effective by, after the model is in action, note the number of employees that have left previously before the model was in action versus the number that have left after the model was in action for a while. And also, as previously mentioned, the public perception of a healthcare organization that constantly has new employees can be perceived as unfavorable. If my model increases employee retainment, which is the main goal, it will give the healthcare organization a favorable public image, which is vital for stakeholders. All of the benefits previously mentioned, such as lower hospital mortality and lower hospital acquired infections, these are all public stats that stakeholders can see and compare to other healthcare organizations. And if they are low, it will improve the image of the healthcare organization, aka its effectiveness, and will be viewed positively by stakeholders. I'm now going to discuss the impact my model will have on processes. Processes are the tasks and goals that an organization has and the help the organization has to achieve its goals. And what changes would occur if my model was in place. All of these processes are going to be discussed a little further in the presentation. This is just a short summary. It will cause improved quality and performance, improve the financial situation, and overall the perception of the healthcare organization will be improve to stakeholders. What impact will it have on motivation? Motivation is a little bit tricky because it will be different for every individual that's in the healthcare organization, because what drives the individual to complete the goals is going to be unique to them and also unique to the healthcare organization they work for. Although promoting a positive work environment, I believe that all healthcare workers will be happier and have less stress at work. And when employees are less stressed, they will be able to focus their efforts more on work. And if employees actually enjoy coming to work, they feel valued, it could motivate them to work harder for the organization. So overall, I believe the impact will motivate employees to work harder. I'm now going to discuss the impact on interpersonal relationships. I believe that interpersonal relationships will improve. If employees are satisfied, they will have improved relationship with their bosses and their coworkers. And if our employees are happy at work, it will also improve the patient relationship. And also, if the membership program is implemented, it will improve the interpersonal relationships in the workplace. And improved interpersonal relationships can help break down barriers between employees and managers. I'm now going to discuss the impact it will have on communication capabilities. And overall, I believe communication will be one of the most improved aspects of the healthcare organization after adapting my model. And why is this? When employee feedback is acknowledged, it will make the employees feel more open to communication. Because if it's actually acknowledged and implemented, they will feel like their input is important and they're valued in the workplace. And no employee wants to feel like their input is unimportant or not valued. And also, employee feedback is really an invaluable resource, especially in a healthcare setting, because healthcare professionals are highly skilled, and ignoring their feedback is really a wasted resource and opportunity. It is really important to have open communication in a healthcare organization, especially between those who provide direct patient care and those who do not, because there's often a barrier for those who are on the administrative side of healthcare and those who are on the clinical side of healthcare. I'm now going to discuss the impact it will have on quality. First, I'm going to define quality. Quality in an organization is really about improving its processes to improve its overall effectiveness, or AKA how the organization is viewed by stakeholders. The quality will improve because of the changes that are forecasted to happen based on my leadership model. And this change will improve the perception of stakeholders. When the stakeholders improve their perception of the healthcare organization, they are more likely to invest. I'm now going to discuss how my model will impact performance. I believe the healthcare organization will improve its performance. Why? A positive work environment can lead to lower patient mortality and lower hospital required infections. This will improve its performance. Many healthcare organizations are dealing with short staffing, and an adequately staffed healthcare organization will perform better than one that is not adequately staffed. How? The healthcare organization can handle more patients, and more patients equals more revenue, and more revenue equals more profit. And also, when a healthcare organization has more profit, they can put the money into where it's needed the most, which will also help improve its performance. I'm now going to discuss finances. I did cover finances a little bit on the previous slide because it was tied to performance, but I believe the model will have a positive impact on finances. And this is because a positive work environment will decrease patient mortality and hospital acquired infections. They also decrease readmissions and adverse events, and this will improve the healthcare organization overall by leading to employee retainment, which again is the main goal, better performance, increased quality, and also increased revenue, as mentioned previously. And all of these look favorable to stakeholders. They will be willing to invest more in a healthcare organization that has a positive perception. I'm now going to be going over the impact on the organizational change management and a quick summary. I believe that the organizational change management will come to the resolution that my model is successful over time. It will be a long process requiring all those involved in their healthcare organization to be on board. The overall goal is to increase employee retainment because of the ongoing staffing issues that have been exacerbated by the COVID-19 pandemic. Promoting a positive work environment is an excellent way to help retain healthcare staff. Promoting and implementing practices that foster and support employee growth and engagement will ultimately lead to a positive work environment, and there is research to prove this. Overall, a positive work environment will improve the stakeholders' perception and lead to employee retainment, which is the ultimate goal. And this concludes my presentation. I want to thank everyone that listened. And these are just my references. I have them listed in order. And there was some direct quotes throughout my presentation, but those are all cited. And this is where I got all the information. And the last reference I have down there is Pixel, which is a free image sharing site that I got all my pictures from. And again, thank you everyone for listening to my presentation.